Hello, my name's Hannah. I'm going to be performing my inserting an IV and discontinuing an IV skill. I'm going to start by performing hand hygiene here. I'm going to go ahead and grab some clean gloves. I'm going to make sure that I have a clutter-free area, also making sure that I have everything that I'm going to need for my skill. I'm going to go ahead and make sure that I have my patient here. I have my IV extension tubing. I have my sodium chloride flush. I have my tourniquet, my alcohol prep pad, my 22 gauge needle. I'm going to be using a 22 gauge needle because I have an 80-year-old female patient who is admitted for dehydration and she's going to be receiving IV fluids. So 22 gauge will be appropriate for that. And I also have my IV start kit, which has my alcohol prep pads, some sterile gauze, my sterile dressing, some tape. And once I have that, I'm going to go ahead and make sure that I have all my items here opened aseptically so I can easily access them. So we'll go ahead and pull it back here, and our IV and our start kit. So once we have that opened here, we're going to go ahead and make sure that we prime our extension tubing. So I'm going to grab my flush here, and we're going to make sure to just be careful so we're not touching any of the sterile connections here. And we're just going to make sure there's no air bubbles. So we do not have any air bubbles there. And we're going to go ahead and set that down. Once we've done that, we're going to go ahead and place our tourniquet on our patient. So we're going to place our tourniquet about 4 to 6 inches above our site that we want to insert our IV. We're making sure that it's not too tight, and we're also checking a distal pulse. And once we've done that, we're going to go ahead and clean our site using a concentric circle going from inward outward. And about for 30 seconds. And once we've cleaned our site using our alcohol prep pad, we're going to go ahead and anchor the vein below the IV site. We're also going to stretch the skin against the direction we'll be inserting our needle. So we're going to go ahead and take our cap off here. We're going to go ahead and anchor our vein, stretch the skin downward. We're going to be inserting our IV upward here. And we're looking for a flashback of blood return into our catheter. And once we see that, we're going to go ahead and advance our catheter another 1/4 inch here. So once we have our catheter advanced, we're going to go ahead and using our index finger, just slowly advance the needle out from the hub. And once we have this, we're going to let our safety device retract and place this directly into the sharps container. Once we have our IV site stabilized with our non-dominant hand, we're going to go ahead and release our tourniquet, and we're going to go ahead and attach our extension tubing with the flush. And this is where we want to be careful we're not touching any of these sterile connections. So once we have that attached, we're actually first going to aspirate for blood return. So making sure we have blood return, what's a good IV, and then we're going to go ahead and insert our flush here. So once we have our flush inserted, we're going to go ahead and clamp this off here. And we're going to remove our syringe, discard that. And now we're going to go ahead and place our sterile dressing. So we're going to go ahead and place our sterile dressing just right over the IV site, nice and carefully. And we're also going to go ahead and tape our extension tubing just off to the side here. And once we have that applied to our patient, we're going to make sure that we initial, date, time, also noting the gauge of the needle, which was 22 gauge. And at this time, I'm going to go ahead and make sure that I have discarded all of my sharp materials into the appropriate sharps bin. And I'm going to make sure that I discard all the rest of my materials that I use for this skill. At this time, I'm going to go ahead and remove my gloves and perform hand hygiene. And that is it for the inserting the IV. So now we're going to go ahead and discontinue our IV. So again, we'll start with hand hygiene. And we'll get some clean gloves here. And we're going to start by removing the IV site dressing. So we're just going to go ahead carefully and slowly remove our IV site dressing. Once we have that, we're going to go ahead and remove our tape that we secured the extension tubing to. and discard of that. And now I'm going to go ahead and grab some gauze, some sterile gauze here. And we're just going to place this directly over the site there. And we're going to slowly, steadily just pull our catheter out. And once we have it out, we're going to make sure that we keep a pressure on the IV site for a minimum of 30 seconds or until bleeding stops. I'm also going to be checking my catheter for intactness, looking for integrity and length. And it does look like it is all intact, and it did come out good. So once we have that removed, we're going to go ahead and dispose of this in the sharps bin. And we're going to go ahead and grab some new sterile gauze. This is my sterile gauze. We're just going to fold it over the area there. And we're going to go ahead and tape it down. And once we have it taped down, we're just going to make sure that we have correctly disposed of all of our sharps materials, and all of the rest of our items have been discarded in appropriate bins. And we're going to go ahead and remove our gloves and perform hand hygiene.